Hello, my name is Isabel Barraza, and I'll be doing a presentation on the disease of endometriosis. So just as a quick overview of what endometriosis is, I included the definition of what the Mayo Clinic defines endometriosis, which is it is often a painful disorder in which the tissue normally lines the inside of the uterus grows outside the uterus, and it's mostly common involving our ovaries, fallopian tubes, and the tissue lining our pelvis. So for the question, what have people thought caused the disease? How did they come to that conclusion, and how has that changed or not changed over time? The first documentation of something like endometriosis was in the 13th century, but in the 13th century, doctors mostly diagnosed women with hysteria, which is now proven to be a mixed diagnosis and was actually endometriosis. So hysteria back then was credited as just a disease with a psychological origin, and that had many possible symptoms and was often a natural diagnosis when the element could not be defined. So a lot of doctors believe that hysteria came from women having an inactive or incomplete sex life, but obviously this definition has shifted to a more accurate understanding of what endometriosis is. So going off of that, as of right now, the exact cause of endometriosis is still unknown to doctors, but it is now very well understood. So one of the widely used theories is that endometrial tissue is deposited in unusual locations by the flow of menstrual debris through the fallopian tubes into pelvic and abdominal cavities. But another strong theory is that it is also hereditary, so it's more common for daughters to have it if their mother has it or if there's a family history of it. So, going off of that, there are still individuals who think that endometriosis isn't real, which leads to a lot of misconceptions about it. A lot of people think that women are not able to have kids if they have endometriosis, which is false because my mom has it and she has me and my brothers. And a lot of people think it's an invisible disease because there are no, people can't actually see the symptoms of it. But as more women have been open about having it, there has been more support and awareness on the disease. So has there been any changes in the way the disease has been defined? How have different symptoms been attributed to the disease? So like I previously said, women were originally diagnosed with hysteria rather than endometriosis. So here I have some symptoms that lead to the diagnosis of hysteria, which include abnormal movements of the womb, infertility, sexual frustrations, anxiety, and excessive pain. Now that we do have a more better understanding of what endometriosis is, the symptoms include painful periods, lower back pain, pelvic pain, pain during intercourse, excessive bleeding, infertility, and pain with bowel movements or urination. These symptoms can vary to women. They can have all of these or none of these. Not none of them, but only some of them. How has the disease been treated by the medical community? What treatments have doctors prescribed, and has this changed over time? So although there is currently no actual cure of endometriosis, there's various methods of treatment involving coping with the pain, such as hormonal birth control, and some at-home treatment could include heating pads. At one point in history, pregnancy was thought to be the cure of endometriosis. So treatments originating from the 13th century included ingesting urine of a man or a bull, consuming pomegranates, fumigants, or trying to reposition the uterus by hanging the patient upside down from a ladder and swinging them around. How has the disease been understood or viewed within society, and has it changed over time? So in 1860, Dr. Carl Van discovered microscopic signs of endometriosis. He saw strange tissue growths around uterus and uterine polyps. And in 1887, Dr. Frank realized that it was women with very small endometrial lesions who were most likely to be diagnosed with this hysteria that they were misdiagnosing for women that actually had endometriosis. Therefore, in 1927, Dr. John coined the term endometriosis, and it wasn't until the mid-1900s 1900s when society started to become more aware of what the disease actually was, which if you think about it wasn't that long ago. So to this day, like I mentioned before, people still perceive endometriosis to be a made-up or invisible condition. But as medicine and society has progressed, there has been an increase of support groups that have formed to bring awareness to endometriosis. Groups like these help women that have been diagnosed to come to terms with their condition, and since there's a community, these women also support other women who have it. And it helps women a lot because back then they were perceived as quote-unquote crazy by being diagnosed as hysteria if they exhibited the symptoms. But now, since there is a community, women are more comfortable showing that they have it. These are my citations. And thank you.